and welcome to Slice of Piefer. I'm Dr. Piefer. I am here by myself. Taylor is sick, so hopefully she's going to be feeling better. I'm certain she will not be listening, so it's all good. But we're going to see if we can kick off this week. We're going into graduation week for everybody here around Texas and around the Woodlands area. We've got kids graduating from 8th grade. I think they're all out of middle school now, which is kind of a weird thing to graduate from the 8th grade, but that's what we're going to do. So they graduated, and then we've got seniors graduations coming up tonight, some last night, and so super fun. I'm on call today, so that's interesting. So could get called away at any moment. Just be aware if you see me looking at my phone, that means that the hospital is calling. Overall, it's been a pretty crazy week. We've been running through all of our normal stuff. We've been busy. We've been moving forward, but also have been working on writing, doing a lot of writing, not only for the book, but also for some newsletters. So if you're interested in getting on the newsletter, we're sending out newsletters on a pretty regular basis. Those newsletters are lots of fun, pressure and purpose. We're getting things, trying to give you a little bit of insight into being a surgeon, leading, and high-stakes leadership situations, managing pressure. And we've talked about high-stakes leadership a lot here. Do you think you work in high stakes? If you do, if anybody relies on you, or if you're serving anybody and you've got to make those decisions, then certainly you're working in a high stakes situation, and you've got to be able to manage those scenarios with folks. So feel free if you have any questions for me that you want me to answer. If we ever get into a situation like this where I'm by myself, then you can always send questions. We've got a few questions that I've got to answer here that have been sent in from people planted to send questions. So one was just defining those high stake leadership situations. And what I've said all along for high stakes is high stakes means high pressure. You've got to be able to make a decision. People are relying on you, and ultimately the outcomes are important, and they affect people's lives. They affect people's livelihoods, and they affect people's environments where they live and work. And so if you're in those environments, then you're certainly working in a high stakes situation, and you've got people who are relying on you to do those things. You've got to be honest. You've got to be founded in purpose, and you've got to be able to manage pressure in a way that allows you to not only relieve the pressure, but to get people where they need to be, so that they can perform and they can live and they can love and they can move forward. Another question that we've got was how do you define purpose? How do you find your purpose, right? What is the meaning of life, right? That's crazy. The meaning of life question is not really what we're talking about, but we're talking about purpose. And what is the difference between purpose and ambition? Ambition is interesting because ambition tends to be centered on yourself. Ambition is centered on you performing something for yourself and achieving some goal. And oftentimes ambition doesn't end up in fulfillment, right? And so what I'm suggesting is that if you're going to set goals, you've got to take time to sit down, be intentional, and understand what your purpose is. If you want to find a purpose, you've got to sit down and start and figure out, what am I going to do? For me, my purpose is willing the good of the other, right? That's serving, that's putting somebody else ahead of yourself. And if you can do that, then ultimately, it's not so much achievement, it's fulfillment that you're gaining as you move forward. So having purpose allows for fulfillment. Having ambition can oftentimes lead to achievement, but not necessarily fulfillment. So focus your purpose on serving others, focus your purpose on serving people around you, focus purpose on lifting other people up, and you'll find that your purpose changes, and not only changes the world around you, it changes yourself, but ultimately that fulfillment. And that's where we see sometimes high achievers still feeling a little bit empty at the end of the day, because they've had a ton of ambition, they've made a ton of achievements, but ultimately they haven't fulfilled what they needed to fulfill, which is ultimately serving others or serving someone other than yourself. As we continue to move forward, we've got the idea for the book, which is going to be High Stakes Leadership, is coming up here, hopefully going to be released in 2027. We're going to work on trying to show folks ways that surgeons and surgical teams operate under high pressure in high stakes situations where there's high trust that's pending. So for us, what that means is we're going to try to build a framework not only for surgeons, not only for future surgeons, but also for leaders that can use some of the techniques and some of the strategies and some of the plans that we use in the operating room to allow folks to be able to manage high stakes and high pressure situations in a way that ultimately wills the good of the people that you're taking care of. A surgical rule or habit. Let's see what you
What's
got.
one surgical rule or habit you develop over the years that isn't taught in textbooks or residency, but has made the biggest difference in your outcomes?
One surgical rule or habit that's not taught in textbooks. Interesting. So a lot of the things are taught in textbooks, right? Preparation, technique, anatomy, that's all textbook. So I think that really the interpersonal interaction with your team is something that's not in the textbooks, right? Having gratitude for the folks that you work with, building up your team, trusting in people to support you the way that they should. I think all of those things are nowhere in textbooks, and sort of that sort of leadership foundation where you look to the team and you say, "Hey, we have an opportunity here to change somebody's life, and we're going to do it together." I think that there's a piece of that that's different. There's a piece of that that you don't find in any textbooks, and you don't really find it a lot in training either. But I think the best of the best leaders understand the value of all the people who have touches during those cases, who have some ability to make a difference for a patient, not only by being prepared, by anticipating your needs as a surgeon, but by anticipating the patient's needs, and then anticipating as we move forward, whether it's the surgical techs, the circulating nurses, the anesthesia team, the equipment reps that are in the room, your assistants, whether it's a PA or a surgical first assistant, and then assistant surgeons. You've got all of those folks, but that doesn't even include the pre-op nurses, the post-op nurses, the physical therapists, all of the team and medical assistants in the office. I mean, there's so many people that that really, as a surgeon, you have to thank. You need to thank because they are the ones who build the foundation of what you're really working in.
All right. How do you handle it when a team member, nurse, tech, PA, resident, is clearly not performing at the level needed, but they're a good person?
So, I mean, I think that takes a little bit of courage, not courage in the way that we're talking about running into a building, but you have to have the not only the courage, but the ability to have a difficult conversation. Because I think people, when you've found that conversation on willing the good of your patients and willing the good of your team and willing the good of the person who you're giving constructive criticism to, avoiding that conversation ultimately leads to poorer outcomes in the future because you're accepting to some extent mediocrity, you're accepting uh, below standards, and people want to do better. People want to be able to perform at a high level. And if there are team members who don't want to perform at that high level and they're just a nice person who's getting through the day, then there may not be people you want on your team. But for the most part, there are folks who, if you approach it in the right way, if you address them from a foundation of love and from a foundation of willing their good, then constructive criticism is just another opportunity to get better. It's not a failure, and it's not a personal attack. And I think when you can take some of the emotion out of that as a leader, you can make that a very positive experience, even though you may be saying, hey, we have an opportunity here to improve and get better.
What's your best advice for someone who wants to speak up in the OR when they see something that feels off, but they're the most junior person in the room?
Uh-huh. So we have something in all of our operating rooms where you have the opportunity to stop the line. If there's ever if there's ever a moment where patient safety is compromised, where sterility is compromised, where you feel that something is not right, you have the power at any level for any person in the room to stop the line, and you're really expected to do that. You're expected to be able to step up and do that, and so we try to empower everybody on our team, no matter who it is, that they have the ability to speak up if something isn't right, and if something needs to be corrected.
How do you personally decide when to push through fatigue versus when to step back during a long and difficult case?
So I think that pushing through fatigue. is a difficult one because that's one of the things that we train for. You train for that your whole career. We train to deal with things like lack of sleep and fatigue. Although um, as you move through your career, you find the more that the better rested you are, the better your nutrition is, the better that prepared you are, the more you've had time to not only exercise but take time for yourself, the better that you'll be. But fatigue can happen, and so if any level of your fatigue is compromising patient safety, then you've got to step back and take a break. Now, you can't take a break for 2 hours in the middle of a surgery while a patient is asleep, but you may need to take a step back, take a breath, reorient yourself, get focused, and make sure you're in a good position. Most of the surgeries we do are not like, 14-hour surgeries, although those surgeries do exist for orthopedic surgery. Um, Sometimes that fatigue choice is do I do the seventh or eighth surgery of the day, or do I have that one get moved back to the next day?
What's something you wish you had known in your first year of out of fellowship, that you had learned the hard way?
First thing, interesting. What's something I learned the hard way in my first year out? I think I think the first, though that first time in that first year when you were a surgeon on your own and it's your first opportunity to lead the room and there's not another attending there, um, almost like a flip of the switch, everyone in the room looks to you for every answer. So every piece of every case, since they haven't done that case with you before, you really need to know every everything about every part, right? Whether it's prepping, whether it's draping, whether it's the approach, it's the fixation, what equipment you need, um, because the teams don't know you. You need to know everything, and so it can be very easy as you're training to rely on your attending surgeons, on the scrub techs, the scrub nurses, folks in the room to help guide you a little bit more. And in reality, once you step out and you step into that first moment, basically it's all on you. And you've got to be ready to not only ask for the things you need, but tell people how you want things taken care of. And most of the time, they'll wait to let you do that. And that, I think, slows things down a little bit, especially for young surgeons early in their first year out.